I think we have everybody in the waiting room in the session. So hi everyone, and thank you for your participation in today's workshop, Fall Prevention 101. As you may know, we are hosting a full week of virtual workshops in observance of Fall Prevention Awareness Week, starting with the session today. Before I introduce our first speaker, I'd like to review some general rules for the workshop. So please stay muted for the duration of the workshop. You'll know that you're muted if you see a red slash through the microphone icon at the bottom of your screen. All workshops will be recorded and uploaded to our website at a later date for people to view. If you do not want your video to appear in this recording, please go ahead and disable your video. You should still be able to hear the speakers and see the presentation. To ensure that you have a good view of the speaker at all times, please select Speaker View. This is located typically in the top right-hand corner of your screen. And then finally, please type any questions that you might have in our chat box, and there will be time at the end of the presentation to go over some of those questions. So our first speaker for today is Kristen Smith. Kristen Smith has worked in the areas of public health and aging for over 20 years. She's been with the County of San Diego's Aging and Independent Services since 2006 and spent many of her initial years at AIS working with the San Diego Fall Prevention Task Force. She is now the Chief of Agency Operations, overseeing AIS Health and Community Programs. Please join me in welcoming Kristen Smith.
Good morning, everyone. Happy Monday morning and happy first day of fall. Every year, California has Fall Prevention Awareness Week during that first week of autumn as just a handy way to know when it's going to be. And so I am really excited to be here this morning with all of you virtually. I can see a few of you on the videos, so that's kind of fun. And so I guess, Carolyn, I'll just say, like, go to the next slide at this point. So next slide. So, thank you. So when we think about fall prevention, I think there's a lot of myths out there. And so we're just going to kind of go through them. And right before we do that, we'll just talk about, well, what is a fall? So when researchers look at this and study it, the definition that they use is that a fall is an event where a person comes to rest accidentally on the ground or the floor, sometimes furniture, and it's not due to something like a stroke or getting hit by a truck. It's something else. And so then when we think about these myths, one of them that I think is very common is that falls are just something normal that happens as we get older. And although indeed falls are more common as we get older, it's not necessarily a normal part of aging. Strength and balance exercises, managing our medications, having our vision checked, and making our home environment safer are all steps that we can take to prevent a fall. And on the flip side of that, another myth, it's not on here, but I've heard people say it quite a bit, that it's just a fluke, like just completely out of the ordinary, never going to happen again. And that's also a myth. If you have a fall one time, you want to start looking at it and figure out what you can do to prevent falls by doing some of those things that we've said. Another myth, as long as I stay home, I can avoid falling. Well, over half of falls actually happen in the home, so that's not going to work. And then if I limit my activity, I won't fall. Now, maybe we don't want you going up on ladders anymore, but in general, performing physical activities, that is actually the best way to help us stay independent. It helps us keep our strength and our range of motion. And that really benefits from exercise and just generally being active. And then finally, well, muscle strength and flexibility, that can't really be regained. I've lost all that. Well, fortunately, not quite. Exercise can partially restore our strength and flexibility. It's never too late to start an exercise program or even just to be more active. Even if you've been a couch potato your whole life, becoming more active can benefit you in many, many ways. All right, let's go to our next slide. So as we said, it does become more common as we get older. 1 in 4 older adults fall each year. Now, not all of those falls end up in going to the emergency department or the hospital. Some people get right up and they keep going. But in San Diego, there were more than 22,000 people went to the emergency department due to falls in 2017. And those are the people who actually went home after the fall. 8,565 went into the hospital, either directly to the hospital or from the emergency department. And 291 died. And then another thing is that falls can really be the beginning of the downfall of our health. It's a major reason for being admitted to nursing homes, and we know that people really want to avoid that. So falls are indeed, it's a big problem. And then falling once, that shows that you are at an increased risk of falling again. People who've fallen once, they have twice the chance of falling as somebody who's never fallen. So let's go to the next slide. So here's your summary. And we're going to go into each of these things in more detail. But the first thing is to speak up. And that is about talking to your healthcare professionals and to your loved ones. Next, keep moving. So I've already talked about exercise, and we'll go into more details on that. But keep active, keep moving. And third, check your eyes. And fourth, make your home safer. So we'll be going into this in much more detail in the next 20 minutes. And so let's go to our next slide. So now we'll kind of think about the flip side. What are the problems that lead us to needing to do those 4 actions? So as we age, we are more likely to have various medical conditions, right? This is pretty common knowledge. But many of these common conditions can affect our fall risk. And on the slide, you'll see we've got this thing, this diagram that shows that 3 behaviors lead to 4 diseases, which cause over 50% of deaths. Those behaviors: no physical activity, poor diet, and tobacco use. We won't be going into tobacco use today, but and that leads to those 4 diseases: cancer, all types of cancer, heart disease and stroke, type 2 diabetes, and various lung diseases, which cause over 50% of the deaths. So because of our lifestyle and because of various factors, those are the 4 diseases that we're more likely to have as we age. Being in poor health and having that limited activity, that puts us at a much higher risk of experiencing a fall. And also, what happens when we have a lot of chronic conditions? We're probably on some medications to manage those, right? And nearly 9 in 10 adults who are 65 and over report that they're on at least 1 prescription med. And what's one of the most common side effects that you see if you look at a bottle of medicine? What is it? Usually I'll say it causes dizziness, right? That can be a side effect. And also some meds can cause drowsiness and problems with our balance. And then also those medications can interact with one another and cause even worse side effects. Let's go to the next slide. So the solution to all of that, we might not be able to get rid of our diabetes or our lung disease or whatever it may be, but our solution to that is to speak up. The best thing to do is to talk to our healthcare provider about managing our chronic condition so that we can stay in the best health possible, even though we might have something, and to find out, well, in light of my situation, what's the best physical activity for me? And then also to have our medications reviewed. And you can do this with your doctor, and you can also do this with your pharmacist. If you are inspired by today's talk and this week's activities, you can, it's really good if you have all your medications with the same pharmacy, and then they can look at your medication list, and you can ask for a consult with them. And then the next time you go to your doctor, you can talk to him or her as well. And then also, if you're experiencing memory changes or you're thinking something is just a little bit different with how you're thinking, consider being screened for dementia. The earlier you find out, the better, and because there are more and more things that we can do to mitigate the problem of having different types of dementia. So in addition to speaking up and talking to your doctor or your pharmacist or both, it's also important to talk to your loved ones if you're concerned about falling. Sometimes people are very nervous to do that. They think, well, you know, I don't want them to know I had this fall. They're going to think I can't handle living on my own anymore. And if approached the right way, you can turn that concern about falling into doing something about it and reducing your risk. And you can involve your family in helping to reduce the risk. So we'll go through the various things you can do together. So let's go to the next slide. So here's the specific questions. We already talked a little bit about these, but this way you can have it all right here. So you'll ask, can my medication contribute to a fall? And how can my current health affect my risk of a fall? And then, would you benefit from receiving a referral? You might benefit from seeing a healthcare provider that specializes in vision, in physical therapy, or occupational therapy, or even something else. So it's a really good idea if you want to get started on an exercise program, but you feel really frail and you aren't sure where to start. Depending on your situation, you might be able to go to a physical therapist to get started and set up a program specifically for you. Another question, should I be taking nutritional supplements? And you might have read various articles about this, vitamin D and whatnot, but what's really important is to talk to your doctor about whether the use of a supplement is right for you. So, and then what type of exercise is most appropriate for you. And we'll be going into that more also. Let's go to our next slide. All right. So questions to ask yourself to see if you are at increased risk. Have you fallen in the past year? Even if you didn't have to go get any medical attention, have you actually had a fall? Do you feel unsteady when you're standing or walking? And do you worry about falling? So if you say yes to any of these questions, you are at an increased risk of falling. And we would suggest that you do talk to your healthcare provider about that. Let's go to our next slide. All right, so we've mentioned physical activity quite a bit. And on this slide, we show how there's a cycle that can happen. If we're not moving, we decrease our strength and our balance and even our reaction time, our responses. And sometimes if an older adult has experienced a traumatic fall, you can develop a fear of falling, and that can make things worse because you can get even less active. And that, if you're less active and if you're isolating, and if you have anxiety about it, and some people get very depressed, all of that, the isolation and the inactivity, you can, you might even start walking differently, you know, much more tepidly and hesitantly. And that's not a good way to walk. That actually puts you at risk of losing your balance while you're walking. So this slide shows that cycle of that fear of falling and that the inactivity, the muscles getting weaker, and then you're at even increased risk, and then you do fall, and then you're even more scared. So what we're trying to do with all of these steps is to break that cycle. Let's go to our next slide. So the antidote to all that is, of course, to keep moving. So all sorts of exercise can improve your balance and very importantly, strengthen your legs. Just think about if you're sitting on the toilet, getting up, what muscles are really important for that? falls happen a lot of times in the restroom, so that's why I'm bringing that one up. But strengthening those legs can really make a difference. So if you're not currently physically active, try to build it into your daily routine. Even just the more steps you get in, the better. Walking to your mailbox, walking around your neighborhood. And if you have those serious concerns, definitely talk to your healthcare provider and to help set you up on a path of more activity. And make a reasonable assessment of the things you can do and cannot do. So you're going to probably start small. Things like climbing a ladder and reaching up to the top shelf in the kitchen that maybe you used to do with getting on a step ladder. Look at that and possibly get help for doing that. Ask somebody in your life to get those things down. But by exercising, you're going to increase your strength, and you'll also be boosting your confidence and kind of getting out of that cycle of the fear. Let's go to our next slide. All right, so for that exercise, and also just for your regular life of activities that you do, we want you to choose your shoes wisely. Quite often, the older we get, we do start going to lower heels, which is a good idea. Something you might not have thought about, I didn't think about it until I got into looking at fall prevention specifically, is shoes with really thick soles. So you can see here's a pair of probably men's shoes, the black ones, and a pair of sneakers. There are sneakers with thinner soles. So you very well might want sneakers, but look for the ones that don't have the super thick soles. That impacts how well you feel the ground, and sometimes you can kind of trip over the toes. So the best shoes are the kinds with the check mark there. You'll notice the features about those shoes is that, well, one, they're flat and the sole is thin. And you want to make sure that it stays on your foot really well. Sometimes shoes like that can be a little slippery, where your foot just kind of slips out of them. You want the ones that are snug around your foot so it stays on. Let's go to the next slide. Okay, so moving away from the physical activity, a risk factor for falls, poor vision. Our vision changes as we get older, and often it is so slow that we don't notice it. In our 40s, we might just have small eye problems, dry eye or digital eye strain, meaning looking at the screens too much. In our 50s, our risk starts going up for things like cataracts. In our 60s, this can happen more, and we can even have like little spots and floaters in our vision. And by the time we get to our 70s and 80s, quite often, a lot of us will have cataracts. And sometimes people don't know that. I have a Facebook friend who just told us a few days ago that she had no idea, but she was just diagnosed with cataracts. And our color vision can decline, and our visual field can narrow. And also, we need more light as we age. So let's go to our next slide. So our solution for that, of course, is to check our eyes. So you want to go to an optometrist at least once a year, or an ophthalmologist. You might have to get a referral from your physician for that, to get that regular eye exam. And they can find out if you have cataracts or something like that. And then to make sure that your glasses prescription is up to date. It can be such a subtle decline that we don't notice. So you want to get checked for all of these things: cataracts, glaucoma. If you have diabetes, you might have damage to your retina. And the earlier you catch those things, the better. Let's go to our next slide. All right, this is the thing that I think people think about the most with fall prevention, and it is more and more important the older we are with our environmental hazards. And also now we're at home so much. And I'm just looking around my home, and I see that, because I haven't had guests over in a really long time, I have been a little more lenient with the clutter. I'm like, who cares? Nobody's here to see it. It's just me and my husband. But that can be a hazard for ourselves in our home. And so we want to do as much as we can to reduce clutter. We want to make sure that we've got good lighting. So poor lighting, that's a risk factor. Slippery floors, and loose mats and rugs, and uneven steps, exposed cords. I mean, look at this picture. This is a wreck. We've got a cord across the floor and loose mats and rugs. Sometimes people have a favorite rug, and we'll get to that on our next slide. Let's go to our next slide. So we want you to, and all of us, to make our homes safer. So we're at home now. I suggest that this is your project this week during Fall Prevention Awareness Week. We've got a pamphlet. We've got the back of the pamphlet is on your screen, and I've got one here. You can just look at it, and on the back, you've got your fall prevention home safety checklist. And you might want to write down this email address. It's hhsa.healthierlivingsd.org. And that's going to take you through all the things you can do in your home, from the floors to the kitchen to the stairs and steps. You know, things like those throw rugs, you can either take them up entirely, or you can get double-sided tape and tape them down so that they stay. You got to make sure that really works. It doesn't work on all floor surfaces. But that would be a thing that you can do if you love your rugs and don't want to get rid of them. So let me look at my talking points here and see if there's anything else I need to make sure to tell you. Oh, we were talking earlier about your kitchen. You want to make sure that the things you use all the time are in easy reach. So whereas you maybe used to keep something up on a top shelf, consider moving that down to a lower spot so that it's easier to get to. All right, let's go to our next slide. All right, there's also different tools that can help you. Of course, walkers and canes, those help improve your stability inside and outside the home, and they should be fitted by a physical or occupational therapist. Handrails and grab bars inside the home, especially in your bathroom, on stairways, they can help improve your mobility and stability, you know, getting up off the toilet, getting out of the bathtub in those slippery places. You want to have some extra support probably. And then rubber mats and bath chairs, a raised toilet seat can be very helpful. And then for the lighting, you'd want to have some night lights and hall lights. And in some cases, if you've had falls already, and you know, some falls can be minor and some can be very significant, and you might need to call for help. Those emergency response systems, the I fell and I can't get up buttons that people wear, or it might be a necklace, those can be very helpful if you are at high risk for falls. And there's other things too that you might not have thought of. And in talking with an occupational therapist, they might have some ideas specific for your situation. Let's go to our next slide. So I think we're actually running ahead of time. This is wonderful. So to sum up, you know, that's like a lot of details, but those are in 4 categories to kind of make it easier to think about. So the first one, speak up. To talk openly with your healthcare provider about your particular fall risk and what you can do to prevent. So that would be with your doctor, with your pharmacist, and any other healthcare providers you have. If you have diabetes, you might want to talk to your specialist about that also, because diabetes is one of those risk factors, and other chronic conditions as well. And then keep moving. So to engage in physical activity, whether it be a formal exercise program or just more walking, and balance exercises. You can do simple things while you're brushing your teeth. Holding on to something stable, stand on one leg if you're safe to do that. That can help improve your balance. But you want to get into an exercise program if you can. Check your eyes. So we talked about that, getting an annual exam and replacing your eyeglasses when needed, and then making your home safer. removing clutter and tripping hazards, especially now since we're all at home so much. And now we'll talk about some resources. This is great. We've got 4 minutes, perfect amount of time to talk about the resources here. We're lucky here in San Diego. We've got the San Diego Fall Prevention Task Force that was formed in 2004. The mission of the task force is to reduce falls and their devastating consequences in San Diego County. And it's made up of service providers and older adults that work on fall prevention initiatives. It's the Fall Prevention Task Force that has put together all the activities for Fall Prevention Awareness Week. And they're the ones that put together the wonderful pamphlet and home safety checklist. So they have monthly Zoom meetings. And so that's an opportunity to network and to learn more about fall prevention. And if you are really interested in this and you haven't been active before, you also can become a fall prevention champion. You can join the task force, start learning more about it. We used to have in the before pre-COVID times, we had 2 chapters. We had one in North County and one in Central San Diego. It's been combined since the meetings are on Zoom now. So you can join those. And then we have a speakers bureau. We've got different champions who are trained to do basically this presentation that I just did for you. And they can provide presentations to your group, maybe a church group or an organization you're in. And right now that's all over Zoom. And we've got that pamphlet that I was talking about, in addition to the home safety checklist in there. There's prevention strategies, there's how to get up from a fall safely, a lot of good information in there. And so if you want to get involved, you can email that same email address I talked about earlier, and it's on your screen. You can write that down, or you can go to the Fall Prevention website, which is sandiegofallprevention.org. All right, let's go to our next slide. There's also national resources. Nationally, there's a Fall Prevention Awareness Day, and the National Council on Aging has created the National Falls Prevention Resource Center. And they have even more experts on falls. On Wednesday, that's September 23rd at 3:30 p.m. Pacific time, they're going to be hosting a panel of experts on Facebook. And they will talk about how to prevent falls now during COVID-19. So we encourage you to take part in our activities that are based here in San Diego this week, and in addition to the national Facebook seminar on Wednesday. All right, let's go to our next slide. And then locally here, we've got the Feeling Fit Club. And right now, our classes are, the best way to participate is either online or on TV. So if you go to thecounty-news-center.com, you can find the Feeling Fit Club. Also, it's on television every day, Monday through Friday at 8 a.m. and 1 p.m. And it's depending on which cable provider you have, it's different. It's if you've got Cox, 19 or 24, I forget which one is South County and North, but and Time Warner and Uverse, those are on at 8 and 1, oh, and 4 p.m. too. I'm looking a little closer at our slide. That's awesome. And then if for some reason those times don't work for you, you can actually request a DVD of the same episodes. And you can also get a stretch band. And you can do that by calling 858-495-5500. And you're going to get a machine, you're going to get a voicemail, and you just leave your message, and somebody will, and they ask you to speak slowly and leave your address, and somebody will send that out to you. Let's go to our next slide. Then also, right now, in addition to specific things for fall prevention, our team here at Aging and Independence Services, our health and community engagement team, has created a ton of resources to help. And you can get that by going to, I'm going to read the one that we have on the screen, sandiegocounty.gov/HHSA/programs/AIS. And for those of you, you might want to do, if you know where print screen is on your computer, you can press print screen, and that you'll get a little screenshot of what we're talking about here, and you'll have that. And on there, there are health and fitness resources. There's also things for other aspects of COVID safety, things like caregiver support, preventing scams. There's a lot of scammers out there right now. Mental health resources. We're all so much more isolated now. Our mental health is a little at risk. All right, let's go to our next slide. I've got to wrap up here. And then finally, also, because we're so isolated, it's even more important to stay engaged, even if it's from home. And that's also on that same website. And we just want you to know that we have a lot of things that we've put together. We've worked with the libraries and with all of our programs to try to get as much things online as possible. And there's even ways that you can volunteer from home. All right, let's go to our next slide. All right, that is it. So thank you very much for listening to this today. We now are going to segue right into our next speaker. But if you have questions, I want to remind you that you can use the chat function, and we'll do all of the questions at the end. We've saved 10 minutes at the end after we speak with Dr. Lu. And so we'll look at those at that time, but you can type them in now so you don't forget. So we're going to be joined in a moment by Dr. Ning Lu. She is a critical care surgeon at Scripps Memorial Hospital, La Jolla, at their trauma center. She grew up in Iowa and completed her general surgery residency at the University of Hawaii. She also completed her trauma and surgical critical care residency at the University of Miami. And so we're going to have a conversation with her with all of this experience, looking especially at the consequences of falls, but I think also prevention. Hi, Dr. Lu.
Hi, thank you for this introduction, Kristen.
Oh yeah, we're excited to have you. So I don't know if we have a specific slide for this part, Carolyn, or not, but we're ready for it if we do. So as I understand it, in addition to treating the consequences of falls, the trauma program at Scripps, there's also a prevention, an injury prevention part of it. Can you explain to us, why is injury prevention a necessary component of a trauma program?
So we're kind of unusual in that we're the only medical specialty that really wants to reduce the number of patients that we see. So by reducing the number of people who suffer accidents and prevent injury, we can thus reduce the total number of injuries. And so for us, injury prevention is critical.
Well, that is wonderful. So looking at the kind of flip side of it, when our prevention efforts maybe didn't quite work, what are some typical health outcomes of patients in those worst case scenarios, the ones who are admitted to a hospital because of a fall?
Sure. So as you mentioned previously, there are a lot of people that are seen in the ER. Not everyone that's seen in the ER has to be admitted into the hospital, but 10 to 20% of all falls result in a serious injury that requires admission to the hospital. This can include head injuries or fractures, broken hips, things like that. And falls actually account for 40% of all trauma-related hospitalizations.
Wow.
So falls are huge for us. Even though when people think trauma, they might think, knife and gun club. In La Jolla, where we're stationed, it's certainly a different kind of trauma. But across the nation, the amount of violent crime is decreasing. Motor vehicle accidents are decreasing, but the number of elderly patients, 65 and older, and the number of falls are actually increasing.
Oh, wow. And when you're talking about them increasing now, in the time of COVID, is that the time period you're thinking of, or longer time period?
Over the last few years, as our population is becoming healthier and living longer, there's a greater number of patients that we see 65 and older, and unfortunately, this is also correlating with a greater number of falls.
Right.
And for most of our patients that are admitted to the hospital, they're staying in the hospital an average 2 to 3 weeks after a fall-related injury.
That is a long time, especially for nowadays when so many hospital stays are much shorter than they used to be.
Absolutely.
You know, if you go in for a planned surgery, even, you know, some kind of spinal surgery, my husband went in and it was like outpatient.
Yes.
And so that is really saying something. If a fall injury, people are in there for that long. Wow.
And that's why it's so serious for us. And even after you're admitted to the hospital, only about 55% go back home if they came from home. 45% end up going to a rehab or skilled nursing facility after that. And so the health outcome doesn't just involve the in-hospital component, but your life becomes different after you leave too.
Yeah. That is really intense and difficult for people. So falls, as we've been discussing, they can really have that variety of outcomes, from no injury to minor injury to very, very serious and even death. And I know in the past, a lot of people were very reluctant to talk with their doctors about falling because they thought that it would mean, oh, they're going to send me into a nursing home right away or something. But for people who still might be reticent, why is it important to talk with your doctor if you've fallen, even if you don't have injuries?
I want to reiterate that it's so important to talk to your doctor if you've fallen, even if you have no injuries, because falling in the past 12 months is a risk factor for falling again. Perhaps last time you weren't injured, but as we talked about, you know, there's a greater number of people getting injured from falls, and maybe you survived the last one, but we want to prevent that next fall. We want to do everything we can to prevent it. And so, you know, 15% of fall related hospitalizations, they're actually recurrent. It's not, not the first fall. 15% of our fall related hospitalizations, it's a repeat fall. And so we don't want everyone to, we don't want repeat customers. Right. My facility is one where I don't want to see any of you while I'm at work, only, you know, out in the community. That's my goal. And so what I want to reiterate is that, you know, if you talk to your doctor, if you've had a fall, even if nothing happened, they can provide all those resources similar to what you discussed in your presentation. We can provide so many different resources, such as small adjustments, you know, as you mentioned, changing your eyeglass prescription, changing, you know, speaking with a physical therapist, occupational therapist, someone who can make minor modifications to your life that can really impact your outcome by preventing your future falls. And what we know is that half of Medicare beneficiaries who have fallen in the past year, they don't tell their doctors about it. And so I want to say, don't be one of them.
Right. Yeah, and I think that doctors they would welcome having that conversation if their patient brings that up, right?
Absolutely.
Yeah, that is good to know. So how do you think that COVID-19 will impact fall rates among our older adults?
I think that it's changing it in different ways. I think that it is increasing fall rates, but in different ways. As you mentioned, exercise is incredibly important. Staying active actually prevents falls. However, what I'm seeing currently is people are actually starting to use equipment that they may not have used in many years. And perhaps, you know, you used to be an avid bicyclist, but you really only used an indoor bike for the last 5 years or so. And so people are suddenly using equipment that they may have utilized easily in the past, but may need some minor adjustments. And so, as you mentioned, talking to your doctor about resources available to help you make adjustments as everyone's trying to rediscover activeness in the time of,
right.
It's very important. I also see some increased alcohol use.
Oh.
And across all age categories, there's a little bit more increased alcohol use, which does predispose people to falls and fall-related injuries.
Sure, certainly can make you dizzy.
Absolutely. And as you mentioned, sometimes people need to regularly see their primary care doctor in order to adjust their medications. And I see a lot of fear in seeing their medical providers, but we have a lot of options now, like telehealth. And so similar to this meeting that we're having here, you can also visit your doctor remotely like this. And that way, you know, your doctor can still help adjust some of your medications or do things that are also preventative.
Yeah, that makes sense. I actually did a telehealth appointment with my doctor, and it was super convenient after I figured out how to use the technology.
Challenging.
And I was really impressed with how she was able to, I had a little issue with my shoulder and she had me do various little things so she could determine where the problem was. And it was a very successful visit. So, yeah.
And the one other thing I wanted to reiterate was, don't be afraid to come to the hospital. There's so much about getting COVID in the hospital, but especially we work here at Scripps, but across all hospitals, every hospital is taking preventative measures. Here at Scripps, we're segregating when you come into the ER an area for people with COVID-like symptoms. They have a separate entrance, they're screened separately, they're kept in a separate area of the ER. So I wanna say, don't be afraid to come to the hospital. It's safe, and don't delay care because, you know, especially for things like head injuries after a fall, time is brain, time is your life. And so don't delay care, come see us. We want to help.
That sounds like very good advice. Our last question for you is, in addition to your duties as a surgeon, I understand that you're also conducting research on balance. Can you share any information about this work and how it relates to falls and injury prevention?
Yes, so right now I'm doing a research project about, you know, help those who are admitted after a fall versus those who are out in the community, and whether or not their balance is different. My suspicion is yes, but there are a variety of different tests that you can perform and screening things that are available both from the CDC and with some new technologies that we have. And so here at Scripps, we're doing a project that's going to involve patients who have had a fall and comparing those out in the community. And what we're hoping to find is a method to help identify people who are at an increased risk of falls before they fall, and just by using balance criteria to help make them help provide adjustments, and maybe they just need to work with a physical therapist or something like that. So screening and finding preventative measures to prevent falls.
Well, wonderful. Good luck. I hope you have some very good actionable findings from that. Those are all of the questions I have for you. And it looks like in the chat, we do have some questions, I think. Let's see. Oh, maybe not. Carolyn, have you seen any questions yet? Let's invite them now, I guess. So they can be either for me or for Dr. Lu.
Yeah, so if anybody wants to use the chat to type in some questions, maybe we'll give it a minute, see if any come in.
Sure.
Yeah, that'd be great.
So if folks know how to do it, you can kind of look around on your screen. Let's see. On mine, it's at the bottom. And then there's a thing that says to everyone, or you could, I guess, make the question just to one person. If it's to Carolyn, that might work.
All right, it looks like we have one that came in.
Oh, okay.
So this could be for either one of you. What is the best way to improve balance?
Well, let's have Dr. Lu answer that first.
I think it's very much multifaceted. First, you have to be able to recognize how is your balance. And so, I don't know, I think out in the community, the best way to assess it is by talking to your doctor and perhaps seeing if you could make an appointment with a physical or occupational therapist who can provide a variety of ways to screen and assess.
Yeah, and I'll add to that. I've done a lot of presentations in the past with fall prevention with Dr. Kim Bell, a physical therapist. So I kind of picked up some of the things that she's talked about with folks. And I know that balance is something that we can all practice and we can all get better at, and that there's so much that goes into maintaining our balance as we walk through the world. You know, we bring in information about the world through our eyes. We have our inner ear, which helps us understand what's up and what's down. We bring in information about the world through our feet, also about the surface that we're walking on. And that's why preventing falls is so multifaceted. But after we bring in all of that information, in order to maintain our balance, we have to react quickly to respond to changes in the environment. And So by practicing our balance, we can improve it. And some of those ways to improve it, we can do through exercise classes, especially exercise that focuses on strengthening our core and that strengthen our legs, and that we're in the exercise, you're safely practicing and challenging your balance. I know Tai Chi is a very good exercise for improving our balance. Tai Chi really helps you know your body and have a good sense of where you are in space, because it's such slow movements, and the way it's taught, it really helps you learn that body awareness. And so if you are thinking your balance is getting a little bit challenged and not as good as it used to be, you might want to start with just doing some exercise classes. Go to the Feeling Fit classes, which are online, and start practicing there. And then if you feel like it's like really some big changes, I mean, it's always a good idea to talk to your doctor and get more specific guidance. So, we have any other questions? We've got a few more minutes.
I did see somebody raise their hand by the last
okay.
name of Weiss, so I'm going to go ahead and unmute this person if you want to go ahead and ask your question. Might have been a fluke.
Well, should we open it up for people to ask questions verbally if they want? Sometimes it's hard to put things in writing. Looks like we don't have a rowdy group.
Yeah. All right. I did want to pull up this slide as well. If there aren't any questions, or if you want to ask Kristen or Dr. Lu any questions separately that might come to mind, you can send it to our Healthier Living email, and we can route all of those up. Uh-oh, I think got another chat. Oh, someone just saying thank you.
Yeah.
So yeah, feel free to email any questions to this address. And let's see here.
You know, maybe we should talk about the other sessions that are happening this week. If you want to do a deep dive into any of these topics.
Sure.
Carolyn, you want to kind of talk about what else is happening this week?
Yeah, absolutely. So we have several different workshops planned for the remainder of the week. We have 4 scheduled each day. So somebody had asked about balance, and as Kristen mentioned, Tai Chi is a really great program for that. In the next session today, actually 11 o'clock, we're having somebody give a demo of our Tai Chi program. So that would be a great session for you to attend if you're interested. So to join any of these sessions, you do have to register in advance, and you can do that by going to www.sandiegofallprevention.org. It's really quick registration. You just put your name and your email in, and you'll get an email back with all of the login information. Again, all the sessions are kind of scattered throughout the day. So we have morning sessions at 9 a.m., 11, and then also afternoon, 12:30 and 2. Some that would be great to highlight are the active classes. So you'll notice a little kind of asterisk on some of the 12:30 p.m. classes. Those are all, they all involve movement of some type, and they're really interactive. If you're a caregiver and you want to learn more about how to communicate with your care partner about falls, we do have a dedicated session for caregivers as well on Tuesday, so tomorrow afternoon. And just really a lot of great, really comprehensive week. So we really encourage you to check out some of these, and registration is still open. So you can go ahead and do that today if you'd like.
I do see one question about Tai Chi and osteoporosis. And from what I understand, any exercise where you are doing weight bearing, load bearing exercise strengthens your bones and builds that bone density. And so Tai Chi would be one of those things, because when you've seen that people are on their, they're on their legs, sometimes on just one foot even. And so that is going to be building the bone density for you. And the question, I believe, is about if there's any Tai Chi moves that are a problem for osteoporosis. And I would leave that to talking with your doctor specifically, to see if there's any movements that you would want to avoid if you have any particular weak spots with your bones. And maybe Dr. Lu might want to weigh in on that as well. Dr. Lu, the question was, are there any Tai Chi moves that are a problem for osteoporosis? Oh, I think you're on mute.
Sorry about that.
Okay.
So I'll be honest, I am not the most familiar with Tai Chi. And so I will happily defer to someone who knows more.
Well, and there's a presentation on Tai Chi at 11 a.m. today. So it's an active class, so you can try it out. It is a very gentle moves. And so by and large, I think it's going to be safe for you. If you can walk, you can most likely do Tai Chi. And then, another question is, what tips for getting back into biking? So many of us want to get back into cycling.
So I am not an expert bicyclist. However, based on what I'm seeing for those who I unfortunately do see at my work, I see a lot of people who are basically making big jumps, if you will. So if you're used to doing, non-incline trails, or, you're used to mainly doing an indoor cycling activities, don't go straight to a big rugged trail. Don't go straight to something with a lot of inclines and declines and tree branches in the way. I think it's safer to take it easy and do a progressive increase in your activity. There are a lot of bike paths that are clean, paved, and don't have, random tree branches in there, because I see a lot of people who get a little too excited and they go from indoor to rugged trails, and they unfortunately do injure themselves. So I think having progressive increases, I think that's important.
So it's kind of this balance that we need to find between the fear that limits our activity and the overconfidence that might make us rush out and do things that we shouldn't do. So it's a really good idea to do a reasonable, aware assessment of our own abilities, start where we are and build up from there. And so that would be even for things like a balance exercise. You're not going to go from having been inactive to walking on a balance beam in a gymnasium. You're going to want to go slow and go from walking to being able to maybe stand on one foot for 10 seconds. Then maybe in a few weeks, you can do that for 30 seconds. Then maybe you're brushing your teeth while standing on one foot. But you're going to build up from where you are to where you can be. So then you're, I think, less likely to end up as one of Dr. Lu's patients.
Exactly.
So, all right. Well, I think maybe just last call for any more questions, and then we can sign off.
All right, I'll go ahead and put this slide back with our email.
Right.
Yeah, thank you everyone again for participating, and thank you so much to our speakers, Dr. Lu and Kristen. Again, we hope that you check out more workshops for the remainder of the week, and everyone stay safe.
Great, thank you.
All right, thank you.
Have a great week.